Hi guys, I'm attorney Manny, a partner at the Rossen Law Firm. Today we're going to be speaking with Bonnie Galvez, who's a nurse practitioner at Miami-Jackson Memorial Hospital. She works in the emergency room. Bonnie's currently right now working the COVID-19 tent, so obviously she's going to provide some insight into her everyday life there. We'll be discussing the epidemic, how it's affecting her everyday life and the community around us. I just hope that this video will leave everyone with a better understanding of what's really going on. Some real news. I know people like to talk about fake news, but just really kind of an insight into what's actually happening in our community. So without further ado, I'm going to introduce Bonnie. Bonnie, how you doing?
I'm good. I'm off for several days, well deserved, and just trying to catch up with some friends and some leisure reading while I'm off. I'm good.
Okay. Well, you're feeling good, feeling safe, feeling healthy, I hope?
Yes,
Okay.
definitely. Mm-hmm.
So you've been a nurse for 12 years, is that correct?
Yes, 12 years, nurse practitioner for 4.
Okay. And so take us back. We'll start when did you start seeing your normal day changing due to COVID-19?
I was just talking about that yesterday. So after the press conference with the mayor and the president of Jackson, everyone just started coming into the ER, and it was from people having just like a small sniffle and a little bit of chills. They were coming in to get COVID testing, or an employer who sent their employee who was sneezing while they were in the kitchen. They're like, oh, you had to go home, get tested, and go to the hospital, get medically cleared. So there was a huge influx in the ER of people with high anxiety, with wanting to get tested, and so that's when I realized that the crisis has started.
And what changes once that influx started happening in your daily kind of routine? What did you see change? What's the normal that you used to every day see, and then all of a sudden, wow, things aren't quite the same anymore?
So, especially when the crisis started, when there was a high influx of patients coming in, remember the criteria for COVID testing has changed. It was only like when you travel to certain places, you were high risk for having COVID for that specific virus. So if you didn't qualify for that, then you would come into the regular ER and, be evaluated. And people were sitting like right next to each other. There was no social distancing involved. People were wearing masks, but then they would come up to you and talk to you, but they would take down their mask, or they would take down their mask to cough and then put it back on. People, a lot of people didn't know like the proper hand hygiene, cough etiquette. So that changed dramatically. We had to, move around the chairs in the triage area. We set up a tent outside of the ER in order to alleviate the influx of patients coming into the ER, to protect other patients and also to protect the healthcare workers. We set up more hand sanitizers in the hospital, put up posters that talked about coughing etiquette, hand washing for 20 to 40 seconds, and social distancing. So if you're going to wait for a provider to call you, and you see someone sitting there, so maybe sit a little farther apart. So yeah, that was like the biggest change.
Gotcha. And I know that all of us together have been seeing, today, it's early April right now. We're even seeing changes that the CDC are recommending, Dr. Fauci. Every day it seems like something new is popping up. What is some of the myths or rumors that you've seen online, or some of your friends talking about, that you're just shaking your head and saying, no, that's not true? Do you have any of that?
No, not really myths. I shake my head whenever I hear of anyone meeting up with someone else, for parties and stuff, or someone that has some fever and a little bit of sniffles, and they're still going to work that's when I'm like, or maybe people are not getting it. Maybe it's not COVID, but maybe it's another virus, but they're still going to work. And that maybe can really compromise someone who's high risk for dying with COVID. So that was my biggest like shaking my head moments. I'm not sure what they're seeing in the media, but definitely I'm not sure if they're not getting the importance of social distancing right now.
And for the tent that you're working, the COVID-19 tent, what goes into that? When was that kind of set up? And can you just walk us through your daily life? Because it's not just work. It seems like you're dedicating your life to this. Walk us through how that's been for you.
So the tent was placed after the high influx of patients that were coming into the main ER. And so in order to deviate the traffic coming in through the main ER, they decided to put up a tent because a lot of people just wanted to get tested. They wanted to be screened. So patients who want to be tested, they don't have any other symptoms. They're not having like, crushing chest pains or like abdominal pain. They're just coming to get tested because they have some symptoms. So, everyone who works in the tent has to wear a specific type of mask. You're getting families of someone who was recently diagnosed with COVID-19, and now they want to get tested. So yeah, basically we'll have like an influx of patients coming in to get tested because they just recently found out someone they were working with or a family member tested positive for COVID-19. So the traffic fluctuates throughout the day.
Okay. And are you administrating some of those tests yourself?
I order them. The nurses will do the actual nasal swab and send them out. And I bring the patients. And
amongst kind of your coworkers, I guess it kind of maybe feels like a family. What are you guys, how have you seen you guys bond together over all of this, and kind of how has it brought everyone closer, I guess, in the medical community? I mean, I'm seeing videos of like the FDNY firefighters parked outside hospitals in New York, just saluting all the professionals. It's one of those things that get you like teary-eyed and almost patriotic to an extent, but more, instead of patriotism, it's more humanism. Like, it's fantastic. So how have you seen that?
The camaraderie has definitely increased, and especially during this time. Everyone is scared. Everyone is they have like a sense of fear. However, especially as nurses and everyone part of the team, from the techs to registration to the physician, the nurse, everyone is willing to help. And they want to stay healthy to be able to help. So we're just all like telling each other, stay safe. We can't, hug each other or anything like that, but we try to motivate each other and, encourage each other to like just stay strong, stay safe. And we look out for another, like, wear your, put on your mask, or like, here's some hand sanitizer or something like that. But we're scared, but we're all very eager to help the community and to hopefully put this behind us. So
as you guys are essentially right on the front lines of this, what have you learned, and what have you taken away from this so far? I don't know really where we are in the curve. That's not for me to find out. That's above my pay grade. But being where we are early April, what have you learned?
That the virus has no mercy. The virus has no mercy. It's an invisible threat to many. And I think that's why people are still out and about in the community and not taking the virus seriously. There's a lot of education that has to go on to the public in order to be able to put this virus behind us and move on. I learned that a young person can be infected just like an older person who's, over 60. And the young person can also go through complications. We've had one of our most very valuable nurse pass away last week from COVID-19, and that hit home. So that's when I learned that the virus has no mercy.
Obviously, sorry to hear that. I think I saw some stuff on that online. So given that, what message, what education do you have for us at home, maybe watching on our computers or phones, whatever it may be, working from home, trying to keep distance? What message do you have to us, and then maybe to some of the immature or uneducated who aren't really taking it seriously?
So a lot of people don't know that you need to wash your hands for 20 to 40 seconds. And it's funny because I placed a poll on Instagram to see what people think in their heads in regards to washing their hands. And a couple people said, until the soap is gone. And it's, as per CDC, there's science behind it. If you place your hands under woodsland, you'll be amazed of how much stuff stays on your hands after washing your hands for 10 seconds versus 20 to 40 seconds. It makes all the difference, and it's supported by science. So washing your hands for 20 to 40 seconds, social distancing, staying inside, we need to stop the transmission, and people are going to work sick. I'm calling people with positive results, and they're at work, whether it's at a restaurant, driving, you'll be amazed. But you can't, trust that people are going to work without any symptoms. People are desperate right now. They're happy that they even have a job, but they're, running, they're living on the edge by going to work and with symptoms. So be very careful. People can carry the virus and not display any symptoms. However, if it touches someone who may not tolerate the virus as well, then it may have bigger consequences. Social distancing, hand washing. If you're coughing, you shouldn't be out, but if you are out, make sure you're wearing a mask and keep it covered when speaking or coughing.
Yeah, I saw today, my dad was even telling me, who is a doctor at the VA upstate, that now they're changing their tone, so to speak, and they being, I guess, the CDC or Fauci, I'm not quite sure, that wearing a mask actually does help. In the past, people were saying, oh, the mask is not effective, it doesn't work, and now we're hearing a 180. So I think it's just ever evolving. And, I want to thank you. Yeah. I want to thank you, thank all the medical professionals out there, everyone in the medical profession. It's a selfless act that you guys are doing every day to service our community. So I want to thank you very much, and for your time today, obviously.
No, thanks for having me.
No problem. Stay safe. And is there any webpage or an Instagram? I know you were talking about one before. I think I've seen some fun stuff that you guys are posting, trying to be educational yet keep it a little lighthearted, that you want to tell people about. We can link it in the bio for you. Okay.
It's on Instagram. It's called Frontline Providers, MIA. My coworkers had the brilliant idea of, in order to facilitate some information to the community, whether it's proper hand washing or the CDC guidelines, or just a day in the life of a frontline provider in the ER. Everything is on that page. So yeah, you can follow us through there.
Thank you, Bonnie. Take it easy.
All right. No, thank you. Bye. Stay safe.